Hi everyone, welcome to my channel 4C Crown of Glory. My name is Disha, and for this segment you can call me Nurse Reid. As you can tell from the title, I am here with a very informative video. I know going into the year 2021, a lot of women are either having a baby or they're getting their quarantine bodies snatched, honeys. So what I wanted to do was come to you all with some surgery supply. Some of you may know that I had a baby not too long ago and I had a C-section. I have a lot of supplies left over from that. And I also went ahead into my little nursing stash, a little mini pharmacy at my house. I have like a lot, I got a lot of supplies. So before I get into the video, I just want you all to know that I am not promoting surgery. I am just promoting safety and education. I've been in the nursing field since 2011 and I've been a mom since 2009. So I am coming here at this platform to share some surgery supplies for anyone who's either having a scheduled C-section or a BBL, tummy tuck, anything like that. Let's go ahead and get started. So I went ahead and I got several categories of surgery supplies. The supplies that I'll be sharing are supplies that I feel are necessary. If you know a nurse, a mother who's had children, a person with a puppy or a pet, you can source your supplies from them as long as they are not expired and as long as they're packaged and sealed. The first category of items that I'm going to share with you guys are medications and supplements. So for your surgery, your provider is more than likely going to prescribe you some narcotic for pain and also some antibiotics. I have some supplements and OTC medications that can help you guys as well. I have extra strength Tylenol. This is very effective for pain. If you can't find or can't afford the Tylenol brand, you can go ahead and get the acetaminophen. That is the generic brand, works just the same. And speaking of narcotics, those can sometimes cause constipation. It slows down your GI tract. And one thing to help with that are laxatives and stool softeners. So you can purchase all of these medications and supplements from your local pharmacy or from Amazon. You want to make sure that you are drinking a lot of fluids and eating some fiber, so that helps with the peristalsis and get all of that gunk and junk out of your system without you getting constipated. The next supplements that I'll be sharing with you guys are very crucial to healing. So the first thing that I have that you should have already been taking at least a month before your surgery is vitamin C. Vitamin C is a great antioxidant and it helps support the immune system. This is also very important for your iron absorption, so you need to have vitamin C on deck. The next supplement that I have is vitamin D. Vitamin D is also a hormone. This is very great for healing as well. And you know, us colored and brown people are sometimes deficient in vitamin D and we don't know how important vitamin D is to us. So go ahead and grab you guys some. Another thing that is great for wounds and healing on a whole and even for hair growth is zinc. The thing with zinc though, it can cause stomach irritation, so you want to make sure that you have something to eat before you take zinc. The next two items that I have are turmeric and pineapple juice. These are pineapple juice capsules. I took these after I had my C-section, great for inflammation. Turmeric and pineapple juice are very great for inflammation, swelling, pain, all of the above. These two right here are very, very important for blood production, for your hemoglobin and your hematocrit, your folic acid, which is a B vitamin, and your iron. And again, I got this one here with vitamin C as well because vitamin C helps with the absorption of iron. So folic acid is very important for red blood cell production, and also if you're planning to get pregnant or if you are pregnant, it is very important that you take folic acid. Folic acid helps prevent any neural tube defects, cleft lips, and cleft palates. Okay, so I mentioned that your doctor should be prescribing you antibiotic therapy. So you want to make sure that you have some probiotics on deck, because the antibiotics are going to basically destroy and kill all of your good bacteria. You don't want any yeast infections or anything like that. So make sure you grab some probiotics, and I would suggest start taking them like your last day of your antibiotic therapy, because as you take them and the antibiotics together, the antibiotics are probably just going to kill them. So I would say in your last day of therapy, you can start taking your probiotics, or maybe 2 nights before your last dose. The last 3 medications that I'll be mentioning are basically for survival, for anyone who has any allergic reactions or asthma. I have some Benadryl here. Benadryl is great for allergic reactions and for the itching. I hear that after you guys have your surgeries, your tummy tucks, the liposuction and stuff like that, your skin is very, very itchy. Benadryl can help with the itching. I wouldn't really recommend taking Benadryl because you're itching. And I'm sure they have some other stuff that you guys can use for the itching besides popping Benadryls. The other thing is an albuterol rescue inhaler. So anybody who is asthmatic, bronchitis, or anything like that, make sure that you guys have your albuterol pumps on you at all times. You never know, you don't want to get caught without your albuterol inhaler. And the last thing that I have here is epinephrine. Epinephrine is for like severe allergies, anaphylactic shock. You feel like your throat is closing up after you've taken medication that you never took before. A lot of people are allergic to antibiotics and they don't know it, and even some pain medications. So if you've ever experienced any allergies in the past, make sure that you guys have your doctors order your EpiPens and keep this on deck too. This and the albuterol inhaler are life-saving drugs. This pill organizer here, or anything like it, is great to organize your pills so that you don't miss your medication doses. The next category that I'll be speaking about is hydration. Hydration is very key to healing and getting all those toxins and fluids pushed out, and it's also going to prevent your blood pressure from plummeting. So here I have electrolyte solution. I know others have Pedialyte. You can drink Gatorade or Powerade, anything with electrolytes. And one of the other most important things is a water bottle. This right here is a liter water bottle. I make sure that I fill this up 3 times a day, so I'm getting at least 3 liters of fluids inside of me every day. As far as anyone having surgery, your doctor may tell you to drink a gallon of water a day. I'm not sure if you guys can do it, because I know that I can't. I could not drink a gallon of water a day. Maybe if I was forced to, but no. I just fill this up 3 times. I have my little straw, sip away throughout the day, and this is how I make sure that I'm hydrated. And it's safe. It's glass, no plastic. Let me take a sip right now. So now we're going to get into wound care and ways to prevent infection. Things first, you should get yourself a little bottle of bleach. This way you can wipe down any surfaces that may have a lot of microorganisms that you don't want around you or your wound, or wounds I should say. And then I have some Lysol spray and Lysol wipes. These are very convenient. You can just spray down the place and wipe down with a paper towel or let it air dry. And then you have these Lysol wipes. You wipe down your area, let it air dry, clean, good as gold. I also have some good old hydrogen peroxide. I love this spray bottle. It's so convenient. Just spray down. Some people use this topically. I don't really recommend peroxide for wound care. However, I do use this for like any bloody secretions. For instance, I do use it, say, if I'm on my menstrual and I get it on my underwear, I just spray it and it gets the blood right up. So I know that this would be good just in case it gets on your sheets and your garments, but be careful because it can change the color of your garments and clothing. This here is some normal saline. This is basically like salt water. It's sterile, great for wound care, and it's what I use to clean wounds while I'm at work. So I love me some normal saline. And then I have some cotton rods and Q-tips. I know some ladies use these to clean their incisions. Neosporin or any antibiotic cream or ointment is very good to prevent infections. I would say you can use this at first, but once your scars start to heal and close, I wouldn't really recommend continuously using antibiotic creams or ointment. I also have some band-aids here, just in case you want to cover your wounds. And then here I have some gauze pads. So these are great because they're individually wrapped, they're sterile, great to clean. Sometimes I use these to cover wounds. However, they can sometimes be drying and pull at any scarring that may be happening. So yeah, it's up to you, but sterile gauze pads are great to have after surgery. These here are some disposable gloves. These are great to have. You want to keep your hands washed, keep your hands clean, and keep those incisions infection free. So disposable gloves are great. If you can get sterile gloves for the first couple of days or few days, that'll be great too, to prevent infection. And after you finish cleaning your incisions, you want to make sure that you have some type of bags, whether it's garbage bags or biohazard bags, to put all of your waste products inside of and discard accordingly. And as far as cleansing your body, I remember the day before my C-sections and the day of, I had to wash myself with chlorhexidine. So this is HydraCleanse, that's the brand. This is a strong antimicrobial and antiseptic skin cleanser. So your doctor should recommend that you get this to use the day before and the day of surgery. After surgery, you can go ahead and use some Dial. Dial is also antibacterial. So grab yourself some Dial bar soap. So paper tape is great to use to keep your dressings in place, and it's not painful when you remove it off of your skin. So that's why I recommend paper tape. And then here is some scar gel. This is Mederma. I use this on my C-section scar. I had 2 C-sections, and when I say my C-section scars look amazing, like no keloid skin, no darkness, like that's what I love about Mederma. I've been using Mederma for a very, very long time, since 2009 when I first had my baby, and I love, 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 love it. So I wouldn't recommend you use this right after you have surgery, but definitely once your scars heal and close, you can use this for about, I think, 6 to 8 weeks. And you're going to see a big, big, big change. So now I'm going to go ahead and get into some miscellaneous sanitary items. So here I have some puppy pads. I see that ladies are spreading these over their bedspreads, on the floors, in the cars when they're leaving from surgery, because there's a lot of body fluids being drained. So if you know anybody with a pet and they have an extra case of puppy pads, go ahead and grab some. Or if you know anyone working in the medical field, ask them for a pack. Matter of fact, never mind, don't ask them for nothing, because things are being rationed due to coronavirus, and we want to keep those in the hospitals and medical facilities. Just go ahead and go buy your own. Another thing that I see some ladies using are shower liners. So shower liners are great, they're cool, but I was just around my house and I have some plastic table cover left over from my daughter's birthday party, and it's so much bigger, and I believe one could probably cover your bed depending on the size, as well as being lined into the car that you guys will be transporting in. I think they're cheaper. I think these are like maybe 99 cents. Go ahead and grab $3 right there. Shower liners may be a little bit more expensive depending on where you go. So if you have some table covers left over from your child's birthday party, go ahead and put that right in your supply bag. Another thing that I see some ladies using for their draining wounds are sanitary napkins or pads, extra absorbent. This brand specifically is organic. These are what I use, but you can use any absorbent pads that you'd like. So it's a good idea to get yourself a pack of pads. And I had to go into my grandma's stash, but I got me some Depends as well. I'm lying, I did not get these from my grandmother. Shout out to her though. These are also great. Maximum absorbency, great for any drainage being leaked. And this is also great for when you can't make it to the bathroom. I heard that ladies are going on themselves because they're in so much pain they cannot make it to the bathroom. So they end up going on themselves. So I would say for the first 3 nights, make sure that you wear yourself some Depends and change them often. In this pack here, there's 18. Just use them. They're not going to run out. for the first several days that you're draining fluids and in pain. I heard that the pain subsides after a while, so keep that in mind. Another cool item that I have is disposable urinals, female urinals. So this one is called Pee Buddy. You stand up and pee. It comes with 40 inside, and they're disposable. That's what I like. You don't have to worry about using and rinsing the same urinal over and over again. Your vaginal area goes here. You just stand up, no bending, no squatting. And the urethral opening is just going to squirt your pee right in here. And the urine is going to come out of this spout here, right into the toilet. But if you don't want to use the disposable, obviously go ahead and get your reusable one. And last but not least, in that sanitary miscellaneous category, I have some wipes. You want to go ahead and get yourself some flushable wipes as well as regular baby wipes. You're probably going to be in pain. Go ahead and wipe them underarms, honey. Have somebody help you wipe your privates, your buttocks area, and you just want to stay fresh and clean. I don't know if you're going to be able to get up and walk to the bathroom to wash up, especially not after the first day. Although I can say after my C-section and epidural wore off, I was up and walking. I got my pain meds and I was good. I was able to wash my face and I was able to, take care of myself. So it all depends on how much pain you're in. And I'm just hoping that you guys don't have to experience too much pain. Take your medication on time and do a lot of walking as much as you can. Okay, so this is my second to last category. I have some skincare items. I got some Aquaphor. This is from the baby line. This is my daughter's. But this thing right here, it's very hydrating. Another thing is like a mild lotion for your skin. This here is from Aveeno. Pediatrician and dermatologist recommended. Very mild. So back to the whole itching thing. This here is some hydrocortisone. This is great for itching and inflamed skin. Maximum strength, of course. That's going to help with some itching. And I also have some Dermoplast here. This is for pain, burning, or itching to the skin. Very cool. You just spray it. And then lastly in this category, I have me some Arnica cream. I hear that this is very soothing. It's great for pain and swelling. So make sure you guys have some Arnica. I know some ladies have like Arnica tea, Arnica gel, and Arnica tablets. Find what works best for you and research Arnica for your surgery. So the next category of items that I have is clothing. So you want to grab yourself some loose fitting clothing. First of all, I can't find my pants. I had some loose fitting pants that I wore after having my C-section. I got them from Amazon. They're so soft, so comfortable, so light, so breathable. I'm gonna see if I can insert a picture here. And you want to go and get yourself some tank tops to wear underneath your garments. You want these to be fitting because you don't want it to like crinkle and wrinkle under your garments and causing any creasing in your skin. Another thing you should get is a couple loose fitting flowy dresses. You are going to want these clothes to be loose fitting and comfortable. You don't want anything tight on you, snugging and snagging. And dark colors are the best to go because you will be leaking fluids. Don't go too crazy with purchasing a whole bunch of clothes. I would say maybe 2 to 3 articles of clothing is what you're going to need. Make sure that you ladies have clean clothing and keep them washed. And here I have some compression socks. And compression is great for venous return, bringing blood back to the heart. Also great for swelling. Your legs may get swollen. Your abdomen is going to get swelling. So you're going to need compression socks. And then I'm going to get into the body garments later on. Lastly, for clothing, you want to go ahead and grab yourself some slides. I would hope that everyone has a pair of slides. Don't go ahead spending unnecessary money on things that you already have. If you have it, that's even better. More money that you get to save. Lastly are the compression garments. Whether you're having a tummy tuck, a C-section, BBL, anything like that, you want to make sure that you compress. I made a huge mistake with not compressing or using the abdominal binder that I was given after having my C-section the second time. But trust and believe, There is a big difference between the 2 C-sections that I had. When I had my first C-section, I made sure I compressed, and after a few months, like, my belly went back flat. However, this time, I did not wear that abdominal binder, and I kind of regret it because the fupa did not go anywhere. Make sure you compress and keep your body contained, and do it on a regular basis. So you are going to need an ab board, you're going to need some lipofoams, you're going to need a faja, I believe stage 1 or stage 2. However, if I were you, I wouldn't purchase those beforehand. I believe that the doctors have their own packages that they give you, and it's best to wait until after your surgery so that they know what size to put on you, because you don't want to get something and it doesn't fit you because it's too small and then you can't use it. You just wasted your money. Yeah, make sure you speak to your coordinator or your doctor about your compression garments. Oh, I almost forgot. Don't forget to get some detergent to wash your clothes. You're going to need to wash your clothes daily. Have somebody wash them for you. Tide has a free and gentle line. I also use Dreft for my daughter's clothes. That's a very mild detergent. You don't want anything harsh and smelly that's going to irritate your skin and your incision. The absolute last thing that I recommend you all getting is someone. Whether you stay at a recovery house with other people, or you have your nurses there or your aides there, or you have a family member, a friend, or anyone traveling with you, you need support. You're going to need support. You do not do this by yourself. You're going to be in a lot of pain. You want to make sure that someone is looking after you. If you are in a recovery house, make sure that the nurses are paying attention to the ABCs. Remember, ABCs: airway, breathing, and circulation. So they need to make sure that your respiration is okay. They need to make sure that your O2 saturation is okay. They need to make sure that your blood pressure is okay, and they need to check your incisions and the amount of fluids that are leaking, or blood drainage that is being drained from your body. And if you're going with a family member or a relative or a friend, make sure that you guys have some vital sign machine. If you have a nursing friend, that's great. They can bring their supplies and check up on you. If not, you make sure that you purchase yourself. Like, this is life-saving. Purchase yourself a blood pressure machine. You can get this from your Walgreens, from CVS. An O2 saturation machine. You put it on your finger and you want to measure your oxygen saturation. Make sure that it's at 96% and above. And then lastly, you know it's Rona time, so make sure that you are all checking your temperatures. This one is a temporal scanner. You don't have to put it in your ears or underneath your underarm. You just press it right against your temporal area or your forehead, and it reads your temperature for you. Make sure that your temperature is not going above 99, okay? Pay attention to your body. Contact your doctor, call 911. I want you all to be safe. That is number one. Remember, we all fall short of the glory of God, and who are we to judge, right? I just want you all to be safe, and I hope that you found this video helpful. And if you want me to continue to make content like this with me giving my nursing experience about surgery or anything like that, go ahead and comment in the comment section below. Make sure that you like this video so that I know that you're enjoying this content, and it's free to subscribe. Appreciate you all for watching. I want you all to be safe, and Happy New Year. See you all in the next video. Bye.